We got picked up at the airport at Nairobi, Kenya, and we got driven down this dirt track to the middle of the Ruben slum. This slum's home to 600,000 people. When we got there, hadn't been warned or anything, but there was a 4-year-old child there, weighed 5 kilos. In Australia, they'd probably be 12, 15, somewhere in that region. This child was skin and bones. We later found out that child actually turned up to the clinic for a measles vaccination. It wasn't even because she was malnourished, but we found out the next day she died within 24 hours from the fact she'd had no food. And something so simple that immediately we figured that we could do something about this.
So we were over there for 2 weeks, and sadly we found out that story of the 4-year-old child who only weighed 5 kilograms wasn't an isolated case. There was a real problem. In the middle of all of this, there's the Ruben Centre. Its aim is to supply basic healthcare, education, vocational training, and basic financial services to the surrounding area. Any nutritional services that were already there were far too inadequate. So with that in mind, we started the Malnutrition Intervention Program. The idea was that we'd target malnourished children between 6 months and 6 years and feed them with a fortified meal called corn-soya blend. By providing these children with corn-soya blend, it means we can get them out of that acute malnourished state. But the beauty of the program is that it's incorporated into the Ruben Centre. It means that caregivers can receive family planning, financial services, as well as vocational training. Because of this, we give the children the best chance of staying out of that malnourished state. It also means that the program will be sustainable.
Having found the idea of putting together the Malnutrition Intervention Program, it needed to be funded. So we came back to Australia, and really quickly after our return in November 2012, we held a dinner for Ruben. Now, dinner for Ruben, we got a bunch of people together, and on the one night we were able to raise $50,000, which now goes towards funding that program into the future. The success stories are actually starting to build up. One of the children that we met while we were over there was a boy named Peter. Now, Peter was severely malnourished, and he was the product of his environment. His father had left long ago. His mother was trying to support 4 children on her own with not enough money to even feed them. Through our program, Peter was able to get the fortified meal that we're giving and be cured of his malnourished state.
These children, they didn't choose the life that they've been given. They didn't choose to have to fight malaria, HIV, malnutrition. They didn't choose to have to go to bed on an empty stomach every night. But we in Australia are in a privileged position, and we can choose to make a difference to these communities.